today, Dr. Mark Cousins is going to be teaching us everything we need to know as a technician about feline heartworm disease. Dr. Mark Cousins is the owner of the Cat Practice Veterinary Hospital in New Orleans, Louisiana. He is certified in feline medicine by the American Board of Veterinary Practitioners and is a frequently invited speaker for many different feline medicine topics. And Dr. Cousins was elected to the American Heartworm Society Board in 2022. Welcome, Dr. Cousins.
Thank you, Dr. Rizzo. It's a pleasure to be here. I hope I can enlighten you guys and show the importance of this particular parasite disease in cats. It's often not thought of and very often forgotten. It's a hard disease to diagnose in the cat. It's almost an impossible disease to treat directly, and all we can do is treat the symptomatology, but it's a very important disease and disease prevention modality in the cat. So without further ado, let's talk about heartworm disease in the cat. The first thing that we want to go ahead and discuss is prevalency rate of heartworm disease in the cat. Does it exist? Why is it a problem? When I went to vet school and I graduated, I hate to say this, but in 1980, heartworm disease in the cat was never even talked about. For some reason, we used to think that the cat was in some kind of way immune to this particular problem. As we know, heartworm disease in the dog is transmitted by the mosquito. Well, that's the same way it's transmitted in the cat. And in Southeast Louisiana, in New Orleans, where I am, there's certainly no shortage of mosquitoes. And what I found in a very informal, but yet eye-opening survey that I did in my feline practice about 1999 was that almost 1/3 of all the cats that came to my hospital were exposed to heartworms. And by that, I mean, we had about 28% antibody positive cats in my practice at that time. Well, let's think about that for a moment. 1 out of 3 cats in New Orleans was exposed to some sort of mosquito that contained a heartworm parasite. Now, we know the incidence of feline leukemia virus in the cat nationwide is about 2.5%. Yet in my area, the prevalency rate of heartworm disease, because of our plethora of mosquitoes, is about 1 out of 3 cats. Yet we bend over backwards to make sure our kitties are vaccinated against feline leukemia virus, and that only has a positivity rate of 2.5%. So we have 2 diseases, one with a 2.5% prevalency rate and one with almost a 30% prevalency rate. And I dare say that most of us don't really discuss putting our feline patients on heartworm prevention, yet we bend over backwards to make sure that our patients are vaccinated against feline leukemia virus. Can you see a problem there? So we just did a survey of coughing cats at the cat practice. Now, these are cats that are clinical and actually are coughing, which is one of the signs, and we'll go into this in a moment, of feline heartworm disease. And we got about the same prevalency rate of evidence of infection in those coughing cats. About 1/3 of those cats were positive for either antibody testing, antigen testing, or heat antigen testing for heartworm disease. And the interesting thing about all these patients was that every single one of these cats were indoor cats. In fact, the cat practice, my practice, is located in downtown New Orleans. We're in a very urban area. So 95% of my patients are all inside. What I want you to understand is that an indoor cat is just as prone to heartworm disease as an outdoor cat is. And in fact, Auburn University studied that very thing, and they looked at the prevalency rate of heartworm disease in indoor versus outdoor cats. And there was no statistical difference in the amount of heartworms that they discovered in both indoor and outdoor cats. So what's the conclusion and what's the takeaway? A cat being inside does not protect it against heartworm disease. And if you think about it, that sort of makes sense because mosquitoes can penetrate the indoor environment. So what do you do as a technician? You need to make sure that when that owner comes in and you're discussing heartworm disease with that owner, and they say, well, my cat's an indoor cat, please point out to them that the indoor environment does not protect that cat against heartworm disease. That indoor cat needs to be on prevention as much as that outdoor cat needs to be on prevention. So the bottom line is that the cat is absolutely positively a susceptible host. And this is where we start to differentiate this disease in the cat versus the disease in the dog because it is much different. One of the big difference between a cat and a dog is that although both species are susceptible, a cat is more resistant to having the adult heartworm disease develop in that circulatory system more so than the dog is. You know, in the dog, we think about seeing those worms in the pulmonary circulation in that right atrium, but in the cat, that's going to be a very, very rare occurrence. But that doesn't mean the cat doesn't get infected by this parasite. And we'll talk about what that means in a moment. So where does disease occur in the cat? And this is really important. Disease in the feline species really occurs at 3 points. First, when the immature worms arrive in the pulmonary circulation, roughly about 3 months after that cat is bitten by a mosquito. So if that cat is bitten on January 1st, these worms arrive in the pulmonary circulation roughly around the beginning of April, the end of March. At that point in time, if you were lucky enough to x-ray that cat, you would see signs that this cat has a problem in the lungs. You would see inflammation around those pulmonary arteries. They would look thick, they would look cut off, and that cat would be sick. What would you notice? Coughing. And a lot of these cats are presented for asthma. In fact, it's not asthma. It's infection by a heartworm disease, a larval heartworm that's causing inflammation in the lungs. Then, if that infection is successful, and if in that rare cat, that worm develops into an adult worm, that patient enters a quiescent period where that worm lives within the pulmonary circulation quite nicely, but there is no inflammation, therefore no resultant clinical signs. Then the next point where disease occurs, and this will be the second area, is when that worm dies. And when that worm dies, that worm releases proteins on the inside of its body into that pulmonary circulation. Now, what you need to understand is that cats don't like foreign protein in their lungs. When that occurs, we get the recurrence of inflammation in the lungs. We get the recurrence of inflammation around the pulmonary arteries and the pulmonary lung parenchyma specifically. We can get coughing again. We can get thromboembolism. We can get acute respiratory distress syndrome. That's what ARDS means. And we can get sudden death. So when that worm dies, that cat can get very, very sick, perhaps even dying. And then the last point where disease can occur is when that larva migrates to different tissues, which it can, like the eye, the brain, or the spinal cord. So these are the three areas where disease can occur. And it's important to understand this because we need to understand exactly what's happening inside that cat when that worm causes problems. As I said before, in the dog, we worry about the presence of these adult worms in the cardiovascular system. So in the dog, it's a cardiovascular event. That heart gets bigger, the dog goes into right heart failure, we get that big abdomen, we get pulmonary edema, and we get a very, very sick patient. But in the cat, this disease, as I've alluded to, is a lung problem. It's a pulmonary disease. And the reason why is because there is a cell in the cat called the pulmonary intravascular macrophage. And this cell in the cat's lung is the mediator of inflammation. This is the cell that causes all the problems in the cat's lung, that causes the inflammation, which results in the clinical signs of coughing and the asthma-like syndrome that we see in the cat. And cats have tons of these cells and dogs don't have them. So this is why in the cat, even though they are infected with only a larval worm, and that worm does not successfully mature to an adult, this is why the cat coughs, because of the amount of these pulmonary intravascular macrophages that are present in the feline lung tissue. So let's look at the clinical syndrome in the cat, and let's see where we can differentiate it from the dog. Remember, the dog is a cardiovascular event, usually caused by adult worms in the pulmonary circulation and in that right heart of the canine. But in the cat, primarily, it's a respiratory disease. And we're going to see coughing. And the coughing may be intermittent. It may not be all the time. And what I'll do with my clients is I'll ask them to send me a videotape of the cat, because sometimes clients can't determine what's coughing, what's vomiting. It all gets very confusing. So a videotape, let them use their phone to get a nice video of the cat, and that way we can determine if the cat's coughing or if the cat's vomiting. The cat will breathe faster. Remember, the lungs are injured, so the cat may have a more rapid respiratory rate, and that respiratory effort may be increased. You may see that abdomen of that cat swelling a little bit more as that cat uses its abdomen to breathe. And you may see acute respiratory distress syndrome. Now, these are these cats that come into our hospital bent over the owner's arms in distress. They're vocalizing, they're salivating, their eyes are wide. These cats are very sick. We have to be extremely gentle with these animals. We'll usually take them to the oxygen chamber, put them on oxygen right away. We'll give them something to dilate their bronchioles like albuterol, start them on steroids. But we have to be extremely careful with these cats because they'll die in your arms if you're too rough with them and if they get too stressed. The next place we may see a problem is in the cardiovascular system. And the only reason why I put this in here is because sometimes a worm will get tied around and twisted around the valve of the heart, and we may see a murmur. This is not common, and this is about the only cardiovascular event in the cat that we'll see. Again, we're not going to see right heart failure in the cat like we see in the dog. The next area that we may see a problem, and this is kind of an important area, is vomiting. What we think happens is that pulmonary intravascular macrophage will release a chemical that reacts in the central vomiting center of the brain and will produce a vomiting syndrome in the cat. So if your doctor is examining a cat that's a chronic vomiter and your doctor can't find anything wrong, the veterinarian can't find anything wrong with the cat, remind your veterinarian that maybe it's heartworm disease. Maybe this cat has a heartworm and this cat's chronically vomiting because this cat's infected with heartworm disease. Sudden death, we discussed this. If that adult worm dies in the pulmonary circulation, the proteins will result in an anaphylactoid type reaction that's systemic, and this cat can suddenly keel over dead. That cat can walk 6 feet, be completely healthy, and then suddenly die. Central nervous system signs can happen. They're rare, but if that worm migrates to the brain or the spinal cord, we may see central nervous system signs. But actually, the most common clinical sign is none. A lot of times, a cat will be infected by heartworm disease and not show any clinical signs. We need to hunt for this parasite if we think it's a player in the cat's health. I'm going to talk about diagnosing this disease because it is not easy. It's not easy at all. And this is a very common test that we use in all of our hospitals, an antigen test. This is IDEX's test. Zoetis makes a test, a witness test, which is very similar. They all have the same principle. They look for feline leukemia virus antigen. They'll look for FIV, feline immunodeficiency virus antibodies, and they will look for heartworm antigen. Now, the antigen that this test looks for is proteins produced by the mature female reproductive tract. The chances of this test being positive is extremely low. In fact, only 1% of cats with heartworms or that have been exposed to heartworms will actually have a positive triple snap test like this. This test will be negative a large majority of the time. If it's positive, fantastic. We know the cat's infected, and we know the cat has at least one female heartworm in that heart. But here's the thing, and this is very important. If this test is negative, we can't look at that client and say your cat is free from heartworms because we don't know. That cat may have an adult worm in the heart. That cat may not have any adult worms in the heart. That cat may only be suffering from a larval infection, which is causing the clinical signs, which are the reasons that owner brought that cat to see us. So if this test is negative, all we can say is that there are no antigens detected in this cat. We cannot say this cat is free from heartworm disease. This is really, really important. I've had a lot of veterinarians come to me and say, look, I don't have any heartworms around here. My triple spot test is always negative. That's a false conclusion. This test was never meant to be a tool to determine the epidemiology or the occurrence or the prevalence of heartworms in an area. this test is too specific for that, and it's just not sensitive enough to determine the heartworm prevalence rate in a certain area. So just understand the limitations of this test. It's a great test. It does exactly what it's supposed to do, and it's very good at it, but it's just not sensitive enough to pick up all the various permutations and combinations of heartworm infections that we can find in the cat. There is a new testing method that's out now. It's called the heat test, and IDEXX and HESCA are labs which both use this. What this test does is it uncouples immune complexes, making antigen detection a lot easier. So let me explain what that means. We talked about the antigen that's produced from the female reproductive tract. When that antigen is produced, the body coats that antigen with antibodies. When this happens, that antigen is not able to be discovered by that test. Let me use this as an example. This is a little case where my headphones are. If this is an immune complex, the test that I just showed you can't find the antigen inside this test. But what we've found is that if you heat the serum of a cat and break down this immune complex, then suddenly the antigen appears, and this antigen can be detected on our test, making our test a lot more accurate. This heat test has helped us diagnose heartworm disease in cats, which would have been impossible to use to detect using the current methods that we have right now. So I encourage you to discuss this with your doctors when you're trying to take blood from a cat and you're wondering what assay to use. I will tell you that at my practice, I use three. I do antibody testing, I do regular antigen testing, and I will use heat testing at one of the labs I just showed you, either HESCA or IDEXX, to try to see if my patient is coughing from heartworm disease. These three testing modalities in combination with each other are going to give us a much better chance of trying to discover heartworm disease in our patients. Heartworm disease therapy, not much to tell you here. There is no specific pharmaceutical that we can use to kill that heartworm in the cat like we can in the dog. Melarsoline or imiticide is far too toxic for the cat, number one. Number two, if we kill that heartworm very quickly and acutely like we do in the dog, remember what I said, that dying worm releases proteins that cat's pulmonary system don't like, and that cat could go into anaphylaxis. So we don't have any direct treatment for heartworms in the cat as of yet. All we can do is treat symptomatically. We'll put these cats on oxygen therapy. If they come in with acute respiratory distress syndrome, we'll use bronchodilators, which will make those bronchioles a little bit bigger to make it easier to pass air through them. Steroids are the hallmark of ameliorating the clinical signs in these cats. The steroid downregulates the inflammation. These cats will stop coughing. A drug called Singulair can help sometime. And of course, we want to make sure that if we diagnose a cat as having heartworms and we know this cat has heartworms, we get this cat on a heartworm prevention that we know can be used in heartworm positive cats. And my prevention of choice is Revolution Plus. That cat has not handled that exposure to heartworms successfully in the past. We don't want this cat to get a second infection of heartworms by being exposed to a mosquito. We want to make sure that cat gets on prevention to stop any further and future infections of heartworms. This study was a seminal study that was done in Auburn University a couple of years ago. And I'm not going to go through the whole thing, but the purpose of this study was to show that even larval heartworms will cause problems in the cat when a cat is infected or bitten by a mosquito that has heartworms inside of it. And I've alluded to this entire presentation. So what I want you to understand, and the important thing about this is that, and this is the biggest difference between heartworm disease in cats and in dogs, is that heartworm disease in cats should not only be associated with an adult worm infection. If that cat is bit by a mosquito bearing heartworm disease and that cat gets infected, even the larval stages will cause inflammation in a cat's lungs. Therefore, the cat will cough. even if they don't develop into adult worms. These larval worms currently, unless we can pick up an antibody level on these worms, these larval worms are very difficult to diagnose. They're very hard to have a positive serology test, except for antibody testing. And the point is that these worms will cause illness in the cat. So this is the biggest difference between canines and felines, is that in the cat, even the larval worms, which have entered the pulmonary circulation 90 days after infection and are maturing into adults, they may not make it, but even their presence will cause inflammation and problems in the cat, and our patients will cough. This is called heartworm-associated respiratory disease, and the only way we can get a definitive answer on that is to take a piece of lung tissue and submit it to a pathology. We don't want to do that with our patients. So this is a very, very difficult situation to diagnose. This is what leads to a lot of frustration in trying to diagnose our feline patients, but probably this happens more than any other condition in the cat. And this is why our patients come to us, and this is why we diagnose asthma in our cats. It's not asthma, it's probably heartworm infection from larval forms of the parasite. So that's the information I wanted to leave you with today. I hope you get something out of this. I hope you recognize how important this disease is in the cat. And more importantly, I hope you educate your feline owners and encourage them to get their cats, their feline family members, on heartworm prevention to prevent this problem in the cat. It's hard to diagnose. There's no treatment. The only proactive stage, and this is where you come into play as a technician, the only proactive thing we can do is to prevent it in our feline patients. And I hope you'll do that to the next cat you see. Dr. Rizzo.
Thank you very much, Dr. Cousins. That was great. Okay, guys, next we are going to welcome Paola Dominguez-Lopez, who's a certified veterinary technician working at the University of Florida in the Veterinary Community Outreach Program. She has served as a board member with the AHS since 2021, and she's put a lot of work into helping us develop these programs, and she is going to talk to us about how she would communicate each of these points to a client in her practice. So let's welcome Paola.
Thank you, Dr. Cousins, and thank you, Dr. Rizzo. Hi, everyone. Today, we'll be discussing how to educate clients on feline heartworm disease. Let's get started. This is Churro. He is an 8-month-old neutered male recently adopted from a local shelter. Churro presented for an initial exam and to get prevention. The client initially only requested flea and tick prevention. When asked if he also wanted heartworm prevention for Churro, he was confused about the heartworm prevention part for cats because he was not aware that they can also suffer from heartworm disease. The life cycle of heartworms, diagnosis, and prevention were discussed with the client. And the client was also informed that currently cats cannot be treated for heartworms, which is why it is imperative that they start and remain on prevention for the rest of their lives. As stated by the American Heartworm Society, when signs are evident, they usually develop during 2 stages of the disease: arrival of heartworms in the pulmonary vasculature and death of adult heartworms. The initial phase is often misdiagnosed as asthma or allergic bronchitis, but it is part of a syndrome known as heartworm-associated respiratory disease. The veterinary technician used all available resources in the room to make sure the client understands the subject. After explaining feline heartworm disease and the importance to start and keep Churro on heartworm prevention, she showed the client the following video.
Most pet owners have heard of heartworm disease in dogs, but heartworms don't discriminate. They're willing to live in cats too. Cats get far fewer heartworms than dogs, but it only takes 1 or 2 to make them very sick. Be warned, once cats are infected with heartworms, they can't be treated. The medication used in dogs simply isn't safe for them. But there's good news. Heartworms in cats can be prevented, so protect your cat by giving preventive medication every month.
If a client asks, do I really need heartworm prevention for a cat? The short answer is yes, but make sure you follow up with an explanation. Sometimes it might take a few different ways of explaining things until you know the client fully understands. Everyone communicates differently. That is why it is extremely important to have different resources available in the exam room. Those being brochures, flowcharts, videos, or infographics. Remember, this can be a completely new subject for the client. Sit down with the client and give them your undivided attention. I know that at times our time is very compromised, but the only way we can truly educate our clientele is by providing them with the time they need. If at a time of the appointment, time is constricted, ask the client if you can give them a call later or email them to further discuss the subject or to answer any questions they might have. This will also show your true intentions of wanting the very best for that pet. So, what different types of heartworm prevention are available for cats? Heartworm prevention is available for cats with monthly doses of either ivermectin or milbemycin oxime as oral preventatives, or moxidectin or selamectin as topical preventatives. Preventatives should be started in kittens at 8 weeks of age. So back to Shuro. Shuro appears to be a healthy young cat. All his vaccines and testing are up to date. During his visit, a CVC and chemistry panel were ran to establish a blood work basis for him. All was within normal limits. After the client had all questions answered and understood heartworms in cats, the client bought a year supply of topical heartworm, flea, tick, and intestinal parasite prevention for his new adopted cat. For more information, please visit our page. There is also a direct link for feline owners. Here you can find resources for everyone. Please go ahead and scan this QR code now for a free membership to the American Heartworm Society while you are enrolled in a veterinary nursing program. Thank you for joining us. Bye.